Okay, so I'm not sure how recording this is going to work, but you go to this website. I use the website, not the app, because I find it works a lot better. Anyway, enter your credentials and log in. When you get here under shifts, skills, and patient care, right here, you're going to create your clinical shift for the date and time. You won't be able to enter any information until you actually get to the clinical date and time, but you can create it ahead of time. So I've already went ahead and created one for right now so that I can enter it. But so you'll see your clinical shift here. Go ahead and click on the shift and it'll bring you to this screen. Okay. First thing I do is I create a patient. Okay, and you put in 999 years. Okay, doesn't matter, male, female. You can see what the required information are. Anything that has one of these boxes, it's going to be required. You can just put it as a abdominal pain, doesn't matter. Secondary isn't necessary. Now, under this patient of 999-year-old individual, you can do male or female. I believe that's required as well. But this is where you're going to enter any miscellaneous skills. So during your shift, if you're not actually following that patient, but the nurse asks you to go and start an IV or do a 12 lead, etc. So let's say like somebody comes in, you're not really following the patient, you didn't do the assessment, they're already there, they're triaged, they're in the room, and you're just going in to start an IV. So venous access, always make sure you clicked I performed this treatment. Anything you witnessed being performed, I also document, but if you perform the treatment, you go here. So under here you have obviously IV with blood draw, etc. And then location, let's say we went in the right AC, it took us 2 attempts, and we used an 18 gauge catheter and normal saline or just a saline lock, whatever. And then successful, yes or no. So we'll say, yeah, it took us 2 attempts, but yeah, we got it. Okay. So now this is you'll end up with multiple, and then, a different patient, right? They asked us to go ahead and give aspirin, right? And we gave, 324 milligrams of the aspirin to this individual. And we gave it orally. Okay. So again, different patient. Patient 1, we started the IV. Patient 2, we did aspirin. But again, these aren't patients that we're actually following. Just miscellaneous skills that we've gotten throughout the day. And then another patient, we went in and we did a 12 lead, and we noticed a 3rd-degree block, right? And then if you did any defibrillation pacing, this is where your electricities would come in. So this was a 3rd-degree block. Let's say they were really slow, whatever, and we're going to go ahead and we did some pacing on this individual also. And it was an external pacing. I performed the procedure, right? So that counts as one of my electricities. Anyway, so this is just, you'll end up with a whole bunch of different things under here. Miscellaneous vital signs, I really don't enter vitals too often. Airway, let's say I just witnessed a intubation, so I wouldn't check that I performed this box. And then we went ahead and did an orotracheal intubation. We used a 7.5 tube. It was successful, although we didn't do it, right? So I performed this treatment, and it took them 2 attempts, right? So now you'll see right here, it says observed. Now, I don't know if that's helpful or not, but I figure if it ever came down to you're short a couple of tubes, but you've seen a whole bunch done, you were, there, but, just kind of watching it. I think that might be helpful. I don't know. That's up to you. Anyway, narrative, right? So this, again, isn't a real patient. So I don't worry about the narrative screen. And then I go to the preceptor sign off. Typically, let's say this is not applicable, right? Because again, it's multiple patients. Physical exam, nah, no, we didn't do a field impression and treatment plan. Skill performance, right? So I did everything that I was supposed to do. I did it pretty well. You know, it was going over well. I communicated well with the patients and the staff. I believe that I was professional behavior was good, and team leadership, not really applicable. Then you're going to ask your preceptor, you know, explain to them that, hey, this is for the miscellaneous skills that I perform throughout the day. You can even go back to the main screen and show them what skills you are claiming that you did. And then they're going to fill out this side over here. So let's say they believe you, you know, and they said, yeah, you know, your skills were really good. Your communication could have been better. You know, you kept talking about your Boston EMS and all that. So they're like, not so much. But your professional behavior was good and not applicable here, right? So then this nurse that's signing off for you, probably the charge nurse signing off, her name is Becky, and her last initial is R, and she's an RN, right? And then she's going to use her finger or whatever to sign this, right? Woo, yay. Okay. Now she can click here, lock it if she wants to, whatever. If they do, they do. You can't add anything after they lock it. And then you click sign off, right? So now all of those skills will be entered, right? You can see that you've acquired your signature here, etc. Okay, so I always create this first, so that way any miscellaneous things. Then let's say a 18-year-old kid comes in on overdose, right? And this is interesting. It came in by ambulance. We're going to follow this patient. So I'm going to go ahead and create a patient. I'm going to say he's an 18-year-old male. I performed the patient interview and performed the patient exam. Now you're just a part of the actual exam, right? The initial encounter of the patient. You don't have to actually go through and do the entire exam, but as long as you were there, part of it, you know, maybe hooking up the monitor, doing different things like that, and you know, whatever. So and at first, when he first comes in, you had to do some BBMs, right? So you successfully managed the patient's airway. We're good, you know, maybe a little jaw thrust and BBM action, and he was responsive to pain, maybe. Or we'll go ahead on unresponsive, right? Our primary impression on this individual is going to be probably an altered level of consciousness, right? Because we know it's an overdose, but we're not, you know, whatever. So then our secondary, I'm going to go ahead and put overdose poison. And when he first came in, patient you know, he's red, he wasn't breathing. You got to take care of all that, right? So under airway, I'm going to go ahead and now I'm going to put all the skills that I put on this one patient. Right, so we're going to do some manual ventilation. All right, and yeah, that was good. Yeah, it worked out well. Okay, and then also under airway, we're going to say that I put a nasopharyngeal airway in. Right, so we're good to go. And then under medications, I pushed the med. Right, so we gave him some naloxone. Right. And what did we give him? We ended up having to give him, you know, 2 milligrams. All right, and we did this via so the intranasal, right, and nasal. So we'll do that. We also we didn't do a 12 lead, right, but we hooked him up to the monitor, and I said, hey doc, you know, it looks like he's in a let's see, he's in a taggy, right. So he's in a sinus tach. Okay, I interpreted it, right. I'm saying, hey, you know, nurse, doc, that's a sinus tach, yeah. And but we didn't do any actual defibrillation or anything like that, so there's nothing there. Then along the way, they asked me, you know, hey, why don't we, before we Narcan him or after we Narcan him, let's start an IV. We're gonna go in the right forearm. Only took me 1 shot, you know, cause whatever. Put a 20. I've also found a lot of nurses, like I go for 18s a lot, and they're like, "Oh dear God, what are you doing?" You know, so 20s are usually pretty good for everything, CT scans, everything else. But anyway, so and it was successful, right? So we've got this guy. These are the different things that we did for him. Under other, there's a bunch of different things in here. Let's say, you know, when he overdosed, you know, he banged his head, right? So I also put an ice pack on the little lump that he has on his head, right? Maybe a little bruise to his ego, yeah. And then afterwards, after he starts coming to, he's a little bit dehydrated. He's just generally deconditioned. So we gave him some normal saline. Let's say we gave him 1,000 ml bolus. And this is we did an IV bolus, right? Cool. All right, so this is pretty much the interventions. Now this might be filled out throughout this individual stay, right? So you can keep going back to this one patient, right? He was having some breathing problems. He was having some altered mental status, obviously. Maybe there's a psych component to it, intentional overdose or something, whatever. So any of these that are applicable, go ahead and click those. Okay. So then narrative, all this stuff is put in there. I usually just like tab it down, and then just a quick blurb, patient brought in by EMS to trauma 1, etc., etc. Perform the following procedures with success. Okay. Whatever, you know how to write a narrative. Okay, so now this individual, right? So whatever nurse you were actually doing, who had this patient, you'd probably have them sign off versus like the charge nurse, right? And you did well in the interview, right? Physical exam, awesome, yeah, great. Still didn't do a field impression or treatment plan because that's not really a thing for us yet. Skill performance, everything, nailed it, right? Communication was good, professional behavior. And team leadership. I mean, if you were actually a team lead, awesome. This really isn't. This comes into play more in the out of hospital setting. It's where you have to get your team lead. So whatever. And nurse agrees with you, right? You stop talking about Boston so much, so she's like, yeah, we're getting there, right? And this is Jan. That's just another nurse, get it? Right, and then Jan signs off, right? Good. Okay, so that's how you log each individual patient. I typically space these out. I usually end up with like either 4 or 5 out of an 8-hour shift. Again, you're asking the nurses for signatures and stuff. Whatever. This one, so then the rest of them I just put under here. Again, if you get something like a pediatric in one of your age groups or whatever, you're definitely going to want to document that because that counts as one of your assessments for the age groups. You do need 30 just general adult humans, whatever. Right. This quick add skills, there was some confusion there. Don't use this. Put all your quick adds under this 999-year-old individual. Because that way you have a signature for it. Okay. After that, so now you've completed your shift. You're getting ready to go home. You're going to go up to the charge nurse and ask her to perform this professional behavior evaluation. Okay. This doesn't require a signature. However, it does need to be done to complete the shift. So go ahead and enter the date here, the time. This is whatever, and then they just go ahead and integrity, blah, blah, blah. Yes, you're good at that. They can also enter whatever comments they want here. I would encourage them to do that, but if they're just busy, just, you can even have, just have them, agree with you or whatever to fill this out. There isn't a signature required, but you just come down through this, tell them, it's part of the new affinity grade, whatever. So they go ahead and fill this all out. There's, I think, 10 different things, and go ahead and do this, submit and close, right? So now that's there. Good deal. So we have that there, and then we're going to go ahead and you can do this anytime. This is the preceptor evaluation. If you're with one preceptor, which is really what this is built for, you would do that. But anyway, it just asks you a bunch of questions. This preceptor, made me feel welcome and warm and fuzzy and was smart and kind and all that, right? You just fill this all out and submit and close. All right. So now our shift is done. Okay, we have all of our different individual skills and assessments here. attachments. You can, you know, if you took a picture of a 12 lead or something like that, you could go ahead and plug it in there. Whatever. Okay. But really that's it. And then you go to lock shift. I'm of course going to delete this shift after this video, but you would just click lock shift, and then when you go back to your skills and patience, you know, the main screen here, it will you know, be locked like this. You know, that it's done. You know, you've got this is all of your signatures are done. Sign off is complete. If you wanted to add any notes to Eric, you know, you could go ahead and add them in here. You know, hey, I left a half hour early, whatever. You could plug it in there. So yeah, I mean, that's pretty much it in a nutshell. So I'm gonna end this video, and obviously I'm sure you'll have some questions, but I thought maybe this would be helpful. Sweet.